March is Colon Cancer Awareness Month, and this is one of those cancers that's much better treated the earlier it is caught. And here with other important reminders is colorectal surgeon Dr. Mitra Ehsan from Overlake's Colon and Rectal Clinic and Cancer Center. Hello.
Hello, thank you for having me on today.
Oh, thank you for being here. So we want to talk first about early screening and why that's so important.
Yes, what we know is that 90% of colon cancers are curable if they're found in early stages. So our job really, and I often tell people, our job isn't even to find early cancer. Our job is to prevent cancer by doing good screening.
Gosh, okay, good to, and 90%, I didn't know about that, okay. And what are some common symptoms of colorectal cancer?
That's pretty much the biggest disconnect we have. Most early colon cancers and pretty much all precancerous lesions cause no symptoms at all. So again, our job is to find people and tell them, look, you've had a birthday, you're in this risk category, check this box and get screening. Because if you wait until you have blood in the stool or weight loss that's unexplained or abdominal symptoms, it will be less likely to be cured and less likely to be prevented.
Okay, and so who is at risk then for this cancer?
Anyone over the age of 45.
Okay.
And in certain populations, including Native Americans, even earlier. So we start screening in those populations at the age of 40. But everybody else at 45, higher risk if you have, of course, a family member who has had colon cancer or colon polyps. If you have inflammation, concerns inside of your bowel, such as inflammatory bowel disease, and then other health concerns, which are actually modifiable risk factors like obesity, alcohol consumption, a diet that's low in fruits and vegetables, and even type 2 diabetes is a risk factor for colon cancer.
Gosh, okay, the food, I didn't know, low in fiber. Okay, something to think about. All of these things, write down. And then how is colorectal cancer actually treated then?
It depends a little bit upon the staging of cancer, and that's one of those nitty-gritties that you get into if you have that diagnosis. So again, first step is screening. If we can find precancerous lesions and remove them, we prevent cancer. Nobody needs surgery. Nobody needs chemotherapy. If we find early cancers, we do staging studies, which include scans, and then we may treat with surgery, we may treat with radiation or with chemotherapy, and all of that is tailored very specifically to the individual's disease.
Okay, and why would people want to choose Overlake Cancer Center for your treatment specifically?
I can speak to that one. I have been practicing surgery in the Seattle area for 25 years.
Wow.
I've practiced at a lot of different hospitals, and sometimes I tell people the reason you're in the hospital for care is for nursing care. We have the best nurses anywhere that I have worked. That said, here at Overlake Colon and Rectal Clinic with the Cancer Center we have at Overlake, we have experts in radiation oncology, medical oncology, we have genetic counselors, we have physical and occupational therapy, we have cancer massage therapy, we have nurse navigators. We have an incredibly supportive team approach to help you have the safest and the best possible outcome. We use minimally invasive surgical techniques, high-tech, state-of-the-art robotic, and minimally interventional techniques in order to give patients a safe, a rapid recovery and return to the life that they love.
So what should people be doing right now to lower their risk? You know, as everyone's always talking about exercise a certain amount of time. Like, do you have any other tips too for people that we can be doing right now?
The things nobody ever wants to hear, right? Eat your vegetables, get regular exercise, don't drink too much alcohol, avoid tobacco exposure. Some of the things that we know are going to create good cardiovascular health. They're going to help you have a better joint health, as you get older. So a lot of the things mom told you to do.
Right.
But probably the most important thing is to have a conversation with your primary care doctor or with your team, I should say, about screening. Because there's a lot of screening forms that are available to us. We think that colorectal cancer screening with colonoscopy is the gold standard. It's the best, but not everybody can get that. So there are stool tests that people can do, and there are other ways of getting your foot in the door. So probably the most important thing people can do is get screened this month.
Okay, and then the age for that too, because this has changed and it recently got younger, right?
Well, it got younger during the pandemic,
okay.
So nobody noticed. But
maybe that's what happened.
It went from 50 to 45 for all comers, and to 40 for those that are Native American.
Okay, and how can people learn more, of course, about the colorectal cancer program at Overlake?
Well, you can go to our website. We have lots of wonderful and useful information there. And I also encourage patients to go to the American Cancer Society's website and the National Institutes of Health websites, because there's a lot of really good information out there. And the most important thing we can do, the colon has a PR problem. Nobody wants to talk about their colon.
True.
People don't even want to
True.
think they have one. But if we can just make some noise about it and have people get screened, that's the key.
Get screened, make noise about it. I like it. Thank you so much for being here and sharing this information. We really appreciate it.
Thanks for giving us an opportunity.
Definitely. And to learn more about what we discussed today or to get in touch with Overlake Medical Center, just visit the website that you see right there on your screen.
This portion of New Day Northwest is sponsored by Overlake Medical Center.